PharmacyToDose, the Critical Care Podcast. And I'm your host, Nick Peters. Wherever you are and whoever you are listening, thank you. So the Monday pod, mini recap pod was unable to happen. We actually recorded a lot of the full recap pod with Anthony Hawkins, but we are back from Phoenix with the last mini recap from Tuesday of the ACCP annual meeting, the last day here. And today's episode is awesome because it's highlighting the critical care PRN focus session, caring for critically ill complex populations, important considerations for the pharmacist. So got to feature three awesome speakers, Christina Rose, Katie Dane, and Jessica Elefritz, as well as the moderator, Zach Smith. And then, of course, we got a little bonus appearance from everyone's favorite Mojda Hevner. So the beginning part kind of talks about what goes into them, what goes into these presentations, how long they've been working on them, talking about how they created the titles, what are pump-up songs if they got to choose, with it kind of being baseball season and the like, but then also giving things like how did they really pare down what to talk about, what are, one fun fact or something for those who aren't here. So definitely listen if you were unable to attend, and then just a little brief mini interlude after, just with some of my thoughts and highlights from that awesome focus session. Keep your eyes peeled later today. The full ACCP recap with Anthony Hawkins, the awesome conference correspondent, will be coming, but the mini recap was getting cranked out first. So enjoy this. Please go back if you haven't and listen to the recaps on Saturday and Sunday. They're awesome. Saturday featuring a discussion with some new fellows of ACCP, as well as some of the students who did the Clinical Pharmacy Challenge. Shout out to Butler Bulldogs. And then Sunday featuring a discussion with two absolute legends in the critical care and pharmacy world with Jimmy Haddon-Kolpick and Judy Jacoby. So go back and listen to those. This is great too. A full recap coming later. Very excited. But for now, let's get into today's Tuesday mini recap from the ACCP annual meeting. Starting right now. And as you could possibly tell from my voice, it is the last day, and we're closing in on one of the last sessions at the ACCP annual meeting. And so excited to be with three speakers, a moderator, and a partridge in a pear tree, a.k.a. We have a special guest crashing the set, which is going to be really fun. But and we're talking about the critical care PRN focus session, caring for critically ill complex populations, important considerations for the pharmacist. So to help put names with voices for the podcast listeners, we're going to kind of go around in the circle here and have each guest briefly introduce themselves. So Zach, why don't you start, and then we'll just kind of pop around here.
Yeah, my name is Zach Smith. I'm a clinical pharmacy specialist in the medical ICU at Henry Ford Hospital in Detroit. I was chair-elect of the critical care PRN, so that is the individual that coordinates the programming, so I'll be serving as moderator for the program.
I'm Katie Dane. I'm a clinical pharmacy specialist at Johns Hopkins in predominantly benign hematology, but I also spend 4 months in the cardiac ICU there. And I'm the pharmacist lead for our anticoagulation and hemostatic stewardship program. And I'll be speaking on autoimmune conditions in critically ill patients, and I've elected to focus on HIT specifically.
Very relevant.
I'm Christina Rose. I'm a professor at Temple University in Philadelphia, and I'm also the assistant dean of admissions, and I practice in the medical intensive care unit at Temple Hospital, and my talk today is focused on obstetric complications in the ICU.
Hello, my name is Jessica Elefritz, and I'm a pharmacist who practices in the medical intensive care unit at The Ohio State University Wexner Medical Center, specifically the hematology-oncology medical ICU. So I'll be speaking on oncologic emergencies today with a focus on CAR T toxicities.
We are in for a treat with all of these awesome speakers, great topics, but we have to start with this. We've got to air some grievances. How did we get the last session on the last day of the conference? Did we, was there like a rock, paper, scissors competition that we lost first, or how, Zach, do you know at all? Can you give us any insight as to how that happened at all?
I don't exactly know why we got the last time slot, but we did have a good time slot this past year, and then our peer and business meeting is on Sunday, which is one of the better days to have your peer and business meeting, so it might have been a trade-off.
All right, well, if we are trading off a really good time for the business meeting versus a really good time for the focus session, prime business meeting is a good thing, but that's okay. But if there's anyone from ACCP listening, we would love to not be the last session on the last day. So there are some very creative titles here. Love that. So how are these punny titles chosen, Zach, from like a planning perspective?
One of the things I've learned in programming is the most important job. The person that's involved in programming has really two jobs: finding amazing speakers, which I think we did for this program, and then the second most important thing is catchy titles.
So AI, are those AI assisted, or how did those get chosen?
I think our programming committee just kind of came up with the topics, and then everyone kind of just got creative, and we tried to come up with like catchy titles for each one. When we were putting it together, really these three individual topics kind of rose to the top, and then one of the programming members suggested like putting them all together, which I think works really well for having like a little bit of variety in the presentation.
Not gonna lie, I'm happy the programming committee came up with the titles because I am the least clever person ever.
So what you're saying is that they the creativity assist is always appreciated.
Oh yes, absolutely.
So for those who haven't seen it, like we'll go into these a little bit. Very good. Keep calm and carry on. Always a chive reference. So caring for the critically ill obstetric patient. The avoiding the CAR T before the horse, oncologic emergencies and critically ill. So strong work. Now, last question from like a kind of high level like planning. So just so we know kind of the timeline, when does work start? Like this is the focus session for 2024 annual meeting. At what point did the work start for this session? Because I'm not sure people understand the length of time it takes to kind of create this these sessions.
Yeah, that's a great question. It starts really right after this meeting. So right after the annual meeting, the chair-elect of our PRN will send out a needs assessment to capture ideas for membership, and then we send that out to categorize which ones are the topics that our membership would view as most valuable. So the process will start really here in the next month and a half, and the ACCP does a really good job about at the PRN officers meeting. They really tell us when these deadlines are going to be, so we'll have ideas submitted in January, and the full final application is like February, March timeline. So a lot of it's solidified here in the next like 4 to 5 months.
All right, so it's like one of those things where like you celebrate, and then the work begins on to Cincinnati, right, on Monday. So okay. Now, let's kind of shift for you three awesome speakers here. So when did you all kind of get involved, and how long have you been working on your kind of presentations and slides from that perspective?
Yeah, so I think in May we were reached out to see if we were willing to speak on the topic. So had the opportunity to accept and then have a group meeting to kind of talk through just the broad plan for the session. As it always is with these sorts of things, the deadlines come up much quicker than you anticipate. So kind of through the summer started thinking about some references, putting some stuff together, but then a lot of the deadlines hit through August, September. So but yeah, similar, we got kind of the slides all done and then was trying to go through to remember what I was going to say. And that's always the big challenge once you get to the meeting.
The week before is like, okay, let's go back and see what we did when we submitted these a couple months ago.
Yeah, no, I agree. I mean, as I was working on the slides, I did try to write some notes about what are the key points to highlight. But, the past few weeks when I re-looked at it, I had to...
Were you able to decipher those notes?
Yeah,
Sometimes I leave myself notes and I'm like, what was I talking about
some
here,
of them,
right?
And some of them didn't make sense. But overall, I have to say, though, even though, as Jessica said, the timeline came up really quickly, it was nice that as the meeting approached, like the slides were already done. So it was painful at the time, but I was grateful, in like the past few weeks that I didn't have to worry about that.
you agree and you're like, yep, that's going to be a future me problem, and then it like comes up very, very quickly.
Yeah, so I agree with everybody with respect to the timeline. It ebbs and flows, as you might imagine. I think the biggest challenge for me was you submit the slides, you don't practice the presentation before you submit the slides. And so for the past couple days, I've been identifying some things to cut back on because I'm definitely over time. So that's been a work in progress. But I think I figured it out. Don't worry, Zach.
Zach has faith, but there was definitely a bunch of eyeballs shifted to Zach at that last statement there. We mentioned too the awesome presentation titles. Definitely need to mention the other focus session, Crimea Liver Updates in HRS Management. So I love that. So you mentioned it's really cool that these were all topics that were kind of floated that would be the prime focus, but the idea was, okay, let's actually kind of bring them in. But when you probably have 3 topics as broad of things like you all are talking about, I feel like that can create its own challenges. So let us kind of peek behind the scenes a little bit. What was your all's kind of strategy to be able to highlight and cover such broad topics in like a short amount of time, right? 30 minutes. These could be 90 minutes all each themselves.
Yeah, great question. So we actually kind of started discussing this pretty early on in group meetings. And I think we came to a consensus that it would be better to kind of be a little bit more focused on our topic so we could provide a little bit more substance rather than kind of like a higher level overview. So that's how I ended up choosing to focus on HIT specifically. It would have been nice to be able to kind of go into more detail about all of the different causes of autoimmune thrombocytopenia in the ICU, but 25 minutes, difficult to do that. So, yeah.
When you're specialized like that, how hard is it to just talk about certain things? Because there's like, oh, I want to add this blip in, or like, oh, but like, nah, they might not know this, right? So this is a great, like, that's got to be pretty challenging, right?
Yeah, super challenging, and that's definitely some of the stuff that I had to cut out in the past few days, unfortunately. But there's still some good clinical pearls in there. So.
Yeah.
Same for me. Complications in pregnancy. There are a lot
really
of things
small,
to talk about,
light,
right?
Nothing.
So I mean, obviously, I had to talk a little bit about like epidemiology and why patients come into the ICU, pharmacokinetic changes. That was pretty straightforward, and that was one of the objectives. And then probably the hardest part was to figure out what acute conditions I wanted to focus on. So I decided to just talk about the 2 most common causes of ICU admission in pregnancy, which is obstetric hemorrhage and preeclampsia, or hypertensive disorders in pregnancy. So that's how I focused on that.
So you kind of, because we've had an episode highlighting it, and there's just tons and tons and tons. So was your strategy kind of like, okay, let's hit the most common, something that the most people may encounter?
Right. So
okay.
I mean, and I'll talk. There's such a small amount of pregnant patients that end up in the ICU when they have complications. And so I just thought what would be the most useful to people. So I focused on what's the most common opposed to, the little niche things that could go on that maybe have, more like cooler treatments, but, what would be most useful, I think,
yep.
to the audience. So that's how I decided on those 2.
I think anything you focus on would be helpful, because I think everybody gets nervous when they see the pregnant patient critically ill. You see me, I remember I had a learner, they're like, Nick, you're putting every drug into like the right. drug reference. And I was like, trust but verify always, right? I don't 100% remember. Yeah.
Yeah, I mean, and because it's not common, I think everybody feels the same way when we get one of those patients in the ICU.
And I'm sure the other presenters feel similarly, but it is tough with these being kind of those unique, complex patient populations, because you really have to balance with providing some background, because these aren't patients that people take care of every day. So you really want to get into the pharmacology and the management for, the pharmacy audience, but you feel like you have to do adequate time and energy to the recognition and background. So it's definitely a balance to fit it into 25 minutes, but hopefully we've got some good stuff and good takeaways for people.
I think especially uniquely a challenge for you, because most people have seen HIT in their practice, or most people are familiar with pregnant patients. Some people might be hearing the words CAR T and introduced to that therapy for the first time in that talk. So that probably was a balance of like, okay, you got to introduce, but not get lost in the weeds there.
Oh yeah, absolutely. Deciding what degree of info to go into versus not is very important, I feel like, in that setting.
Okay, so I'm a huge fan of fun facts and pearls, nothing better. So let the audience in, especially for those who may not be here. What's maybe a fun fact or a pearl from your presentation that you can kind of let the audience in on that you're going to be talking about in this focus session?
Well, I can go ahead and start. I'm going to be talking about the CAR T toxicities, so obviously a little bit of CRS and ICANS. But there's been a lot of emerging data on more of the hematologic toxicities, and so I'm going to be talking a little bit about the HLH-like syndromes. There's been a consensus panel recently working on some definitions that can be usable, and it's really being recognized as more of a distinct syndrome separate from CRS, and some of the medications that you might go to are a little different. So hoping to focus in on that towards the end.
Okay, now I do have one follow-up because this spurred my memory. I've asked both Heather May and Matt McKenzie, so I have to ask you, so when you get into this like hem-onc world, do you just have to practice those names a lot? Do they give you like a tip sheet? How do you do that? Because if I have to say those words, I swear I have the pronunciation everywhere. I'm doing it 10 times before and I still screw it up.
Oh, yeah. I mean, I just try to say it as confidently as I can. That's what I tell students when they're asking about drug names on rotation. But no, the HLH one definitely is a little tricky. I'm trying to only say it once during the presentation and get it right, and then I'll just be using the acronyms every single time.
Once you say it correctly, you can find me in the audience, and I'll be so impressed when that happens, because that's such a complicated
I'll be looking
name.
for
So
like the big thumbs up. I feel like seeing it on the slide as you pronounce definitely helps out, though.
Okay, yeah, okay, perfect. All right, so unfortunately, no quick trick.
No.
Just hard work. Dang.
No.
All right, we gotta figure that out.
So fun fact. Not really fun fact, maybe sad. One sad fact, and then one we'll talk about what's in the presentation. But
yep.
Something surprising that I think not everyone knows is that out of all the developed countries, the U.S. has the highest maternal mortality rate. A lot of it has to do with like people having higher maternal age. We do a lot more C-sections in the U.S. and there's lack of access to care, and that's like specifically more for like minority populations, which, you wouldn't be surprised about that. But one thing that I'm going to focus on obstetric hemorrhage in part of the presentation and the treatments for that. I think medications that like most clinicians aren't really comfortable with just because they're not seen in the ICU. So just diving into a little bit more about those medications. And then there's certain patient populations that, would be beneficial or harmful in one versus the other. And that's really how we decide on which one to select. And so I'll go a little bit more into that during the presentation.
Okay, I'm glad we didn't end with the first one, because you're right, that was sad, and I actually didn't know that. But yeah. I like the what you're going to talk about at the kind of the end there. That'll be really important.
Yeah, and I'm not going to go into a lot of it, but I know a lot of like critical care and ED people love TEG. I'm going to mention it, and that it can, there is, I think, some more data coming out about using it to guide blood product administration and postpartum hemorrhage. I'm not really sure how much pharmacists would be involved with that, but since I know a lot of pharmacy people get excited about TEG. That's another population it can be used. I
know you said TEG. Brian Gilbert's flying back right now. I know that, but he definitely just like smiled on the plane because he heard you say that. So that's perfect.
Well, on brand for me, I can't narrow it down to one, so I'll share two quick ones.
Even better. That's me too, for the record.
Pretty on brand with my excessive slides for this. So the first is that IVIG is an emerging treatment option for HIT. And it can be considered in patients who have a contraindication to anticoagulation or in addition to anticoagulation for patients who have a more refractory HIT course. The second is that the 4T score does not perform well in patients who've undergone cardiac surgery. And so there's an alternative score that can be used called the CPB score, which has much better sensitivity in that setting. So we'll be talking about that a little bit.
Okay, that was great. I had no idea about IVIG. That was a great fun fact. I'm glad you included two. That was very worth it. Okay, so I asked this to the FCCM groups, the CPP group, when they did their presentation. So I want to ask you all, what do you want from the audience? How can we help you all be the best speakers that you can at this session?
I think for me, it'll be really interesting to hear what questions arise based on different practice patterns at other institutions. So I'm looking forward to what discussion might unfold based on that.
I like it. You're looking for all the questions.
Yeah, I'm looking forward to it.
I love that. I only had to emphasize because I would say the majority of people are like, please don't ask any questions.
I guess I'm just looking for some good attendance. I mean, as you stated, we're at the last session, and it'll be nice that people are able to learn from all the hard work that I think all of us put into the presentation. So,
yeah, I agree. Same that both everyone else has mentioned. But yeah, I think especially with my topic, the questions can be helpful because you can kind of see what people that don't practice in the setting routinely are interested in or might not know about, and they honestly have great ideas for things that you don't always think about in routine practice. So us critical care pharmacists are pretty astute, so it's always nice to hear the different ideas and questions that come up from the audience. And
the thing that I hear is when you're knowledgeable on a topic, you love getting all the questions. And then we just definitely have 3 knowledgeable speakers here, which is awesome. Now, I think the real question is going to be, with what we might expect would be lower attendance in some other sessions, how far back does it go, even with the dwindling? Like, do we get the back row? How far back do you think it hits? I think we still get someone in like the back too. Always, right? Like tale as old as time, but we'll try to encourage, maybe try to get in the front, right?
Okay. Yeah, maybe someone with a flight that's trying to sneak out at the very end.
Oh, you know what? We will look to see if there's luggage and help them out there. You're absolutely right. I will let the speakers know I feel like I am a good audience member. I'm a big head nodder and smiler, so I don't know if you look in the audience or I'm looking in the back. Try not to look at anybody, but that is a resource. Okay, last but not least question. So last session of the day, we're trying to pump up the mood. So if you were able to have a walk-up song as your introduction to get the crowd hyped, right? Picture it's baseball playoffs right now. Picture that same environment. What would it be?
I'm going to go with the Philly theme, and I'm going to have to say the theme song to Rocky, even though I'd say it's not my favorite song, but, I'll support Philly and go with the Rocky theme song.
Will you be doing the fake boxing maybe, as you go?
Absolutely.
I feel like that's required. It's a combo with that if that's your song. Philly through and through though. That is a key message there.
So kind of keep with the same theme. I appreciate the baseball reference. I live in Baltimore. I'm a huge Orioles fan.
I'm tough 2 seasons.
Year,
I'm so sorry.
Tough year, but I'd have to go with an ode to Gunnar Henderson and choose the Gwen Stefani "Sweet Escape" walk-up song. A lot of crowd involvement with that one.
Do you have one, Mojda? Does Mojda have? Yeah, okay. So I told you that we had someone crashing, and Mojda's been very quiet until now. So Mojda, introduce yourself, and then just say hi.
Hi, I'm Mojda Hevner. No longer immediate past chair of the critical care PRN, but past, I guess now.
3 years. Just finished your 3-year term.
I did.
Congrats.
I'm officially
How's it feel?
Done with the leadership position. It feels great. It feels liberating, and I know that the PRN is in great hands.
Yeah.
So.
Yeah, absolutely. Okay, what would your walk-up song be?
So, fun fact about me is that before I give any talk, I actually listen to Sarah Bareilles' Brave and get myself pumped up.
That is the most fun
before I go
fact.
out and pump up the audience.
Okay, so that's already your pump-up song.
Yeah.
So that would be it.
Yeah.
Awesome. That is, okay. I love that. So I will share, when I was doing residency interviews, it's actually funny, Jessica's here who interviewed me for a residency, I had a song each year that would pump me up for my residency interviews. So Suit and Tie, Jay-Z and Justin Timberlake was one year. The Man by Aloe Black was one. I forget what the third year one was, but gotta get pumped up, right? Gotta start feeling it. Okay.
Yeah, absolutely.
I was actually going to say the Rocky song as well. That's all right. I was thinking like one of the training montages from Rocky IV.
Okay.
But if I have to give a different one, I probably would go with more recently with the Detroit Lions doing better. Eminem has kind of reemerged, and the "Lose Yourself" song has kind of reemerged as like the Detroit song.
Yeah,
you pick that one.
Your Michigan crew might have been pretty mad if you went with the Philly song and not a Michigan song. So that was a good last second pivot. I think that's a good one. All right. Edited or unedited?
Edited for the
I know, I'm just kidding.
Definitely edited.
I guess last but not least, I guess for personal pump up, I was trying to think of maybe something by Young the Giant or something that's a little high energy.
Oh, yeah.
But
My Body,
I feel
Cough
like
Syrup.
just for audience, maybe like Katy Perry Firework or something, just get some good vibes out there and belt out some music.
Something that could get a sing-along would be a good... Yeah, I agree. That's a great one. Okay, so maybe we'll find a speaker, and if you're in this con, maybe you'll be surprised with a few walk-up songs. You should come to the focus session to figure that out, although when you're listening to this, the focus session has already happened, admittedly. But thank you all for joining. I think the focus session is going to be really awesome. Very excited to listen to it, and I am very pumped that you all would come on, talk a little bit about it, and of course, like, have some fun with all this. So thank you all so much.
Thanks for having us.
Okay, and when you last heard us, that was before the focus session, recording this right outside the room right after. Wanted to give some initial thoughts because kind of as expected, with it being the last session of the conference, it wasn't as well attended necessarily, definitely as it should have been, because what an awesome session with tons of really cool pearls and tips and tricks from these speakers. But before we get into that, I realized I actually forgot to add up my walk-up song. So historically, it would have been Big Papa by the Notorious B.I.G., but I've been very into the song "Dancing in the Dark" by the Bruce, right? Bruce Springsteen. Ironically, my karaoke song as well last night. So I'll use that as my answer here of what my walk-up song would be. Okay. Instant thoughts on the room. It was cold. It was very cold. Ironically, thought that the temperature in the conference center was way better until today. So I now get why so many people had a blanket or something of the like. Can confirm, right? We talked about would there be people in the back or anything? Can confirm, 2 people in the very back row. Now, somebody made a comment that, are they trying to catch a flight or something like that? And it's like, okay, that actually does make sense. You don't want to disrupt, what have you. But great presentations. Talk about a few highlights. So the session started out with Christina Rose discussing the critically ill obstetric patient. I loved the picture she used when going through ADME, right? Talking about absorption, distribution, metabolism, and elimination, but also, not only having the classic notes of which one goes up and down, but they also, she also included that in the image of like the organs themselves, whether it's, it's a visual perspective to help understand all those kind of complex PK/PD changes, showing where in the stomach or liver these changes happen. So really cool visual aid in this presentation. And another piece that really stood out was Christina's discussion into the pharmacotherapy, helped explain why certain adverse effects could occur, right? The mechanism behind it, which was sometimes kind of complicated, to be honest. And then how to have a semi-stepwise approach when thinking about how to add or increase your treatments in these population. So that was really cool. And then, as Katie Dane mentioned, so she was the second speaker, and as she mentioned in our kind of pre-talk, her autoimmune presentation focused on HIT, or heparin-induced thrombocytopenia. And she started off with a bang because she had like a visual description, almost like a picture, a story of like a picture story in a sense, the pathophysiology of HIT, things like PF4s and IgG complexes, which were just explained beautifully. And when describing the 4T score, what I really loved is there was a Pearl section, and it gives you insights and practical advice on using these, which some of them were new, and then some of them would be things that I think all in practice consider, but it's good helps and tips regardless. Also, one of the big things was IVIG treatment, and I also didn't know that IVIG can cause false negatives with the SRA when testing for HIT. So that's good to know, as she talked about that could be an emerging treatment. And then shout out to Taylor Robichaux, who appeared to collaborate on some of this with the phrase, the slide courtesy of Taylor Robichaux, seen on the bottom of some of those slides there. So Jessica closed out, And as she walked up to the podium, I started to think about what's the best speaker slot within a session. And I got to think it's probably going first. I got to think it's going lead off. But at a certain point, I'm not sure it really matters unless you're really nervous about how it goes. And you're just sitting up there thinking about it. So, again, these were 3 incredibly gifted, talented speakers. So I doubt any of them had any care or nervousness about where they were. It's just my rambling thoughts. But I thought it was very funny when she started off talking about all the different complications with the organ system. She said only a few of them are listed here, right? And there were 19 of them. And so it showed how many complications can actually occur in these hem-onc patients, where giving highlights is, just under 20 of them, where in, a lot of other patients that would be listing all of them. Loved the slide showing where the treatment worked based on the pathophysiology of how the CAR T adverse effects occur. Definitely extremely helpful. Learned that many centers are only letting patients get 2 tocilizumab doses before looking to escalate care, which is different than the 4 doses you may see in like the literature or the guidelines. I was like, she said that Jessica said she was only going to pronounce HLH once, and she crushed it. And the other thing is, there were extremely complicated names and diagnoses through the presentation. Unbelievable job. I mean, we talked about it afterwards. Even the abbreviations are complicated and hard to say over and over, like IECHS, right? And all these different things. So it was a really, really great job. Zach, the moderator, right, who you heard in the opening part, he had a good question. What's one pearl you would give for the critical care pharmacist who would, only treats a handful of these patients? And that I think that could be a large group of listeners, especially if you're not in a center that has like a hem-onc ICU or a really big hem-onc population. So the 3 answers. Jessica emphasized collaboration with other healthcare professionals, which makes complete sense with how complicated, how many organ systems can get affected, how important coordinating care is for those patients. And that was a similar realm with what Christina said of, working with the OBGYN team, while also emphasizing kind of timely delivery and administration of medications, because a lot of them are so time sensitive. So maybe working with your operations and things like that if they're not stocked in certain places. And then the last one, Katie said hers were negative consequences to HIT testing, right? Like stopping of heparin and that sort of thing. But then also when you're working up HIT treatment, it's just stopping the heparin while you're waiting for those to come back is not adequate treatment with that morbidity associated with it. Got to get a DTI on board. We really need to give, these 3 presenters their flowers, because there were less people here simply because it was the last presentation of the conference. ID Week and NCS, where I'll be heading, are also going on right now. But the presentations were awesome. I'm glad they were able to join. We were able to have some fun, but also highlight the PRN focus session, talking about all these kind of complex, critically ill patient populations. So keep your eyes peeled later today when the full ACCP recap featuring everyone's favorite conference correspondent, Anthony Hawkins, will get posted later today. We're going to crank out this mini recap of the Tuesday, and then the full will follow. Next time you hear from me starting tomorrow, right, we'll be in San Diego for neurocritical care, talking to the awesome pharmacy group, doing a lot of cool things there. So keep your eyes peeled. But for now, enjoy this awesome mini recap featuring the speakers and moderator from the Critical Care PRN Focus session. So huge thanks again to all 3 speakers, and then, of course, the moderator and special guest for coming on. It's a busy conference, so it was really cool to get to peel them away and get to have them give some of their thoughts to the audience, especially those who weren't here. So huge thanks to them. What a great talk. And reach out to me at PharmacyToDose. You'll notice if you follow me on Instagram, we've been putting up some of the awesome research posters. So be sure to follow me there if you want to see what research is happening not only in ACCP but then NCS. The website, PharmacyToDose.com, reference lists, old episodes, much, much more. And then, of course, reach out to me, old-fashioned email, PharmacyToDose@gmail.com. But until next time, I'm Nick Peters, and this is Pharmacy to Dose, the Critical Care Podcast.